Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks if I can analyze a presentation example that involves depression and loneliness. So a presentation example is when a therapist documents interactions with a client, the client consents to this, and then they report on what happened with the treatment, the outcome, what techniques were used, and a variety of other elements related to that clinical experience. They're done for educational purposes, and sometimes presentation examples are called case studies or case analyses. So the case I'll look at here was featured in a book that was published in 1973 called Uncommon Therapy. It was written by a psychotherapist and theorist named J. Haley, and it was about a man named Milton Erickson, who was both a physician and a hypnotherapist. Now, J. Haley and Milton Erickson were controversial. For example, both of them used hypnosis as a method of treating mental disorders, and of course hypnosis is not a form of psychotherapy. The role of hypnosis in treating mental disorders is a polarizing topic and beyond the scope of this video, but suffice it to say, it's one that a lot of people don't agree on. And in mainstream psychotherapy like cognitive behavioral therapy and other popular therapies, hypnosis is not a part of that. So that's one controversial component. We also see that some of the counseling techniques that they advocated would not be considered ethical by today's standards. Some of the techniques are part of what's referred to as strategic therapy, like the paradoxical intervention, otherwise known as prescribing the symptom. The ethics of a technique like this would be determined by the situation, so sometimes it may be ethical and other times it wouldn't be. For example, if somebody was counseling a parent who is trying to get their child to stop throwing temper tantrums, they might encourage the parent to tell the child to go ahead and throw a temper tantrum, to throw a temper tantrum at exactly 6 o'clock and make it last for a half hour. A technique like this might make the child feel like they're now following instructions, right? And that kind of runs antithetical to the purpose of a temper tantrum. But other situations, like when dealing with substance use, could be trickier with a paradoxical intervention and could actually encourage a relapse. If somebody came in and said they were drinking too much alcohol, the counselor would not want to encourage them to use more. So again, kind of a tough area in terms of ethics. We also see that J. Haley specifically believed that psychoanalytic thought provides no value to a modern-day therapist, and certainly that's debatable, but there's also a lot of brilliance in psychoanalytic thought, so it's a little worrisome to think that we have to throw that all away. He also thought that the diagnoses of borderline personality disorder and schizoaffective disorder are simply made up and don't have any operational value. And of course we know from scientific literature that these two disorders are in fact real, and we see them all the time. So with all this in mind, it's understandable that many modern-day mental health counselors look at the work of J. Haley and Milton Erickson as something of a novelty. Individuals who are willing to push the boundaries of what would be considered ethical these days, but not individuals that provided anything useful beyond that. Sometimes, however, an outside point of view, an unconventional point of view, can provide an interesting perspective on how to be an effective counselor. Even if the techniques described can never actually be used, that doesn't mean they lack any educational value. The book Uncommon Therapy has a lot of unconventional thinking. As I mentioned, it focuses on the psychotherapeutic techniques of Erickson, which were really inspired by Erickson's version of hypnosis. His therapy was thought to be a special type of interaction between people. To emphasize this special type of therapeutic relationship, the book contains several case studies. The cases reviewed in the book, of course, are cases where the treatment outcome was a success. Erickson also had many failures, and they are not mentioned in the book. This arrangement, however, only talking about the successful outcomes, is disclosed in the introduction of the book. One of the case studies featured in the book, arguably the most famous one, features a 21-year-old woman who sought out Erickson for therapy. She was depressed, felt inferior, was lonely, and was worried about the future. She wanted to find a husband, get married, and have children. So she wanted kind of the classic family life of the time. This case took place somewhere in the 50s or 60s. Now, at the time she came to see Erickson, she had never had a boyfriend, she had never even dated, and she was afraid that she was going to be an old maid. At 21, perhaps a little too early to be worried about that, but that was her fear, and I've certainly seen this several times with many people. This fear of always being alone. She didn't have any romantic contact with anyone, but she also seemed lonely in general. She didn't have any friends, her parents had both passed away, and she lived alone in her house. She believed that her lack of success in finding a husband was due to her being homely. That's how she described herself. She described herself as homely. She told Erickson that she decided to give him 3 months to straighten out her situation, or she was going to end her own life. So we see kind of the effects of the depression and the loneliness, right? She's at a point of desperation as she comes in to see Erickson. This woman worked as a secretary at a construction company, and every now and then there was a young man in the office who worked for the same company who would show up at the water fountain at the same time that the client did. Now she found him attractive, and he was clearly sending signals of attraction to her. He was attracted to her, but she would never speak to him. She actually ignored him. So with this, Erickson saw an opportunity in her situation and took an unusual approach to take advantage of it. Erickson thought of this woman, this client, as attractive, but he believed that she made herself appear unattractive by doing things that were easily correctable. She was wearing a blouse and a skirt that didn't match. One of her skirts had a rip in it, her hair was disheveled, and her shoes were unpolished and scuffed. It's not clear if the client recognized that she appeared to be frumpy, at least in the opinion of Erickson, but she did believe that she had a physical defect that made her unattractive. She had a gap between her 2 front teeth. It was about 1/8 of an inch wide, quite common, and described by Erickson as not unsightly. I imagine it's not dissimilar from the gap that I have between my 2 front teeth, so in that sense I can kind of connect with what that client is feeling. Milton Erickson used this particular feature, the arrangement of her front teeth, as part of his therapeutic strategy. Now, many counselors in this situation would be encouraging and positive. They would tell the client that she was attractive, or that there were a few small things she could change to be much more attractive, but Erickson went in a completely different direction in this case. He threw out this idea to her that as she was headed toward self-destruction anyway, she might as well enjoy herself. She might as well have one last fling. He suggested that she take whatever money she had in the bank and spend it on herself. She could go to a clothing store and pick out an attractive outfit. She could go to a hair salon and have her hair done. And this wouldn't be done as an effort for her to improve herself, but rather just as a way to have fun, since she was on the way out anyway. That's kind of how he viewed it, and that's how he presented it to her. So Erickson was accepting of her position. He was going along with the idea that she would not be alive in 3 months. So in a way, he kind of dodged the resistance. If he had said to her after she talked about ending her life, "Please don't do that," or something to that effect, maybe she would have pushed back. Or maybe she would have responded favorably. But either way, worried about the resistance, he kind of sidestepped it with this technique and went along with her idea. He didn't make any moral judgment about what she was thinking about doing. He just left all that aside and went with this idea of having fun in her last few months. The client accepted Erickson's first suggestion, but he had one more suggestion. He wanted her to go home and, in her bathroom, practice squirting water through the gap in her front teeth. Specifically, he wanted her to continue practicing until she could accurately squirt water at a distance of 6 feet. So, highly specific instructions for this particular task. Now, she felt that this suggestion was absurd and silly, but due to these very characteristics, the oddness of it, she decided to follow that suggestion as well. So after the client got her clothing and hair situation straightened out and had practiced squirting water through the gap in her teeth, Erickson threw out the idea of her playing a practical joke on that young man who appeared at the water fountain at the same time that she did. Again, that young man that worked in the same office where she worked and the one who liked her. Now, he wanted her to squirt water at him, but he had a very specific way in which he wanted her to do it. After she squirted water on him, she was supposed to run toward him and then churn quickly down the hallway and run vigorously. Now, the client didn't like this idea. She thought of it as crude, but eventually she decided to do it. It was one last wild thing as she was on her way out anyway. On the next day that she went to work, she followed Erickson's instructions, and when she squirted water on the young man, he was surprised, and then of course she ran down the hallway. He chased her, grabbed her, and kissed her. Now this was distressing for her, but not to an intolerable level. The next day at the water fountain, he surprised her by spraying her with a water pistol. The day after that they had dinner. A few months after that they were married, and about a year later they had a baby. So this is an interesting case that really illustrates how Erickson went about therapy much differently than other people, and of course an interesting case in terms of how somebody can be depressed and lonely, and that can turn around very quickly. Now the criticism of Erickson in this case, of course, would be that the solution seemed incredibly obvious. The client is an attractive young woman who is not helping herself through her clothing selection and the way she keeps her hair. She also has a person at work who is interested in her, and her goal is to find somebody to marry and to have a family with. One doesn't have to be a counseling expert or a mathematical genius to figure out the solution here. The vast majority of people who come into counseling, in some manner of speaking, bring the ingredients they need for a solution, but usually it's not this obvious. An analogy to this would be if a client brought a 2x4 with a nail in it into therapy, and they're holding this board in one hand, and the other hand they have a claw hammer, and they're like, I really want to get this nail out of this board, what do I do? Right? So, I think most counselors would have an idea of how that could happen. But what Erickson does, again kind of sticking with this analogy, is says, well, sell that hammer that you have in your one hand, go out and buy a saw, and saw the board in half right next to the nail, and the nail will fall out. Right? So kind of a roundabout way to fix the problem. The solution was pretty clear. What was really different in this case example was how Erickson approached putting the parts together to obtain the solution. Right? So again, it seems obvious how one gets to the solution, but he approached it differently. And in the opinion of some counselors, this way was a much more dangerous way to get to this obvious solution, albeit quite creative. It was clever to use her perceived physical defect, the gap between her teeth, to facilitate flirting with a romantic interest, and I think this is really one of the best features of this case and of the strategy that he used. It removes something negative completely. Again, she thought of that gap in her teeth as a physical defect, and it adds something positive, all in the same move. In a way, I suppose it was also clever to avoid resistance in this case, but the problem here is that she was talking about ending her life, and it just seems too risky to go along with that in any way. I think it can make sense to avoid resistance in less serious situations, so we do see again some learning value here as this case is presented. Another problem here, of course, would be the ethics of what Erickson did. What if that client did something drastic? Erickson really didn't do anything to discourage that behavior. Now, some counselors have made the argument that Erickson's interventions in this case really just amounted to some sort of gimmick, and that many clients would see through the obvious goal that Erickson had here. So way in advance they would see what he was trying to do. And I'm inclined to agree with this perspective. Many clients would see through this immediately and would know exactly what the counselor was trying to do, and that may not always be a bad thing, but I think it would kind of sidestep the effective portion of this particular intervention, at least as the way we see it conceptualized by Erickson. Outside of the risk of harm and the ethical considerations in this case, I would say this is the next most problematic component of the intervention. Few people are going to fall for those types of tricks, and I don't think it's a good idea that counselors look to trick clients in the first place, right? That's not a healthy way to have a relationship with a client. The client should know what the counselor is trying to do. You don't have to be sneaky or tricky to be a counselor. Now, again, some counselors may look at this case and say, well, it really wasn't sneaky or tricky, it was clever. But sometimes there's a fine line between those constructs. So that's my analysis of this fairly famous case study we see in the book on common therapy. I know whenever I talk about topics like depression and isolation, there will be a variety of opinions. Please put any opinions and thoughts in the comment section. They always generate really interesting dialogue. As always, I hope you found this case analysis on depression to be interesting. Thanks for watching.